forward
Ladies recognize.
and speak on the amendment in the nature of a substitute. First, I want to thank Congressman Bill Arakis for offering the amendment and for his long history of support for people with rare diseases as the co-chair of the Rare Disease Caucus. I'm proud to say that I worked with your father in 2003 to pass the original bill that required pediatric studies in drugs, and I look forward to continuing that legacy with you. It pains me to say this, but I can't support the AINS today unless my amendment is accepted. But I pledge to continue working with you, Mr. Bilirakis, and colleagues on both sides of the aisle to get to a very important bipartisan solution. The AINS does have several important pieces of legislation included in it. First, the Give Kids a Chance Act directs drug companies to conduct pediatric studies of combinations of cancer drugs and therapies. Cutting-edge cancer treatments involve a combination of drugs, and kids deserve to benefit from that scientific advancement. I'm proud to have introduced this legislation with Congressman McCall of Texas. Second, the RARE Act, introduced by Representatives Matsui and Bilirakis, clarifies existing law so that orphan drug exclusivity only applies for the specific approved use of rare disease drugs. And this bill preserves important orphan drug incentives. Third, the Creating Hope Reauthorization Act awards drug makers with valuable vouchers for marketing a treatment for a rare pediatric disease. The AINS today leaves out another critical bill that Representative McCall and I introduced as part of our package to help children with rare diseases, the Innovation in Pediatric Drugs Act. This legislation closes the loophole that allows more than 1/4 of all rare disease medications on the market today to have no studies in it for children. This legislation is an important counterweight to the pediatric voucher program, which is only for diseases that primarily impact children. When a rare disease affects both children and adults, the drug company will often get a treatment for the disease approved for adults and not study it in children. Children who suffer from rare diseases are therefore left behind. Doctors, pharmacists, and parents are cutting pills and mixing medicines, hoping the children under their care receive a safe and effective dose. This legislation would require drug companies that successfully market a rare disease treatment to test it in children with the same disease. Pediatric studies are usually required after a drug is already on the market. When pediatric studies are late, and FDA has found that many required pediatric studies are more than 10 years late, FDA's only recourse is to take the drug off the market. This legislation allows the FDA to enforce pediatric studies the same way it enforces drug studies. We should build on the longstanding strategy of our essentially carrot and stick approach to pediatric drug development. The AINS offered by Congress Bilirakis unfortunately doesn't maintain that legacy, and it impacts children with rare diseases and also impact adults. So I offer this rather long but important explanation to all of the members because undoubtedly every single member here wants to improve remedies for children. And what was left out, if it can be added in, which I believe is a very important addition, we're going to have, I think, the most strengthful package for pediatric drug use in our country. So with that, Mr. Chairman, I yield.